The female lower abdomen. First, we take a few moments to repeat the anatomy of uterus, ovary, and fallopian tube. Uterus, the gonads, and the fallopian tube are situated in the lower female abdomen and can be examined by vaginal sonography. The transabdominal sonography can be of a great help, especially when the bladder is filled. The size of the uterus depends on the age of the woman and on the number of deliveries. Before adolescence, the uterus is 3 cm long and 1 cm wide. The diameter of the cervix is even larger than the one of the uterus. The uterus of the sexually mature woman is 5 to 9 centimeters long and up to 4 centimeters in diameter. In women who have given birth to more than one child, the uterus may be up to 10 centimeters long and 5 centimeters wide. The uterus may increase in weight during pregnancy from 50 grams to 2 kilograms. If the uterus cannot be detected or is extremely small, this may be for the following reasons: older age of the patient, or a very young patient, or a very rarely state an inherited malformation syndrome. Using this picture, we can repeat the anatomy of the female lower abdomen. We see the uterus with cervix, body and fundus, the ovary on both sides, and the fallopian tube. And nearby the ligaments, we see the guiding arteries for the ovary, the ovarian artery, and also sometimes branches from the uterine artery, which supplies the gonads on both sides. In the longitudinal scan, we have to identify the regions of the uterus. So once again, we see cervix over here, body and fundus. We see the vagina in this region, and the same structures are seen in this abdomen ultrasound. Cervix of uterus, body and fundus, and very clearly to see over here the vagina. Dorsal to the urinary bladder. On the screen, we see now a longitudinal scan of the uterus. Over here, body of the uterus, fundus and cervix. In this case, the bladder is empty and it's not so easy to detect the vagina over here and cervix over here. Once again, when the bladder is empty, it's not so easy to detect the structures, but we can nicely see the fundus of the uterus, the body and the cervix over here. Now in the transverse scan, when the bladder is empty, we see fundus in the near field and cervix and the vaginal segment in the far field. Once again, uterus, cervix, and nearly no volume of the bladder is seen. So, let's go on for some scanning. So we go on with the scan of the lower abdomen in a female patient. The female pelvis is scanned in a longitudinal and in a transversal view. We start with the longitudinal view, place the probe in the midline and check the marker heading towards the head of the patient. So the nose of the marker shows to the nose of the patient. Keeping contact with the pubic bone, and we can see this lovely picture on the screen. We see the bladder over here in the near field on the screen, and dorsal to the bladder the vagina is located, and cranial we see the whole uterus with all its parts, the cervix uteri near to the vagina, and in the most cranial part the fundus uteri in between the corpus of the uterus. Dorsal to the vagina we find gas, which is located in the rectum. So we scan this area by sweeping the plane to the patient's left side and the other way around to the patient's right side. And by doing this maneuver, we can detect organs of the lateral pelvic wall, which is seen over here, the right ovary. In this part of the screen, the ovaries are oval shaped and the size is in between 4 to 6 centimeters. So, once again, the echo-free bladder, vagina and uterus. Dorsal to the uterus, we find the space of Douglas, the recessus recto-uterina, which gives place to free fluid if there is abdominal bleeding or ascites. So if you're looking for signs of abdominal bleeding or ascites, this region is of our greatest interest. In this particular case, there's no free fluid seen, so a healthy patient. So we're going to scan another female patient. In the longitudinal view, we see the bladder, dorsal to the bladder, the vagina, and here we can see the uterus with cervix uteri, which is located near to the vagina, and the most cranial part of the uterus, fundus uteri. And in between we can see the body of the uterus. We can easily detect the muscle layer and the outline of the uterus and the inner portion with the endometrium and the bright echo in between here. Now we rotate the probe 90 degrees anti-clockwise, so the nose of the transducer shows up to the nose of the sonographer. And we are scanning the organs from cranial to caudal by tilting the probe downwards, and check all these organs again. We see the bladder, dorsal to the bladder, parts of the vagina, and more cranial, we can detect the uterus. Depending on the filling of the bladder, the uterus is elevated and pulled into a dorsal position when the bladder is full. And when the bladder is empty, the uterus tilts down and lays on the empty bladder. So in this case, we have the position of the uterus quite cranial and dorsal. We can see the outer layer of the uterus, which is hypoechoic, it's the muscle layer, and the inner portion of the uterus is with increased echogenicity, it's more brighter, and in this particular case we have a strong echo in the uterus because of an intrauterine device, a contraceptive coil over here. We check whether the nose of the probe is heading to the patient's right side. We tilt the probe upwards in order to find the uterus. And in this particular case, we can detect that the uterus is located slightly to the patient's left side, which is quite normal. And the position of the uterus is in this case cranial and left-sided due to the filling of the bladder. Now we managed to find the fallopian tube on the right side, or oviduct, which gives us a hint where we can find the ovary on the right side. We follow the course of the fallopian tube to the location of the ovary here. We check the female pelvis in longitudinal and in cross scan and find no tumor, no cysts, no bleeding or free fluid. We can check the pouch of Douglas once again, which is located dorsal to the uterus and is the deepest place in the intra-abdominal cavity and gives place to free fluid if there is abdominal bleeding or ascites in the abdomen. To get a correct measurement of the endometrium, it may be necessary to zoom into the picture and to take a clear border of the endometrium to the myometrium and to detect this area and measure this thickness. The endometrium has to be less than 50 millimeters thick. After menses, it should not be detectable. And in women in menopause, it should be less than 8 millimeters. We have pathologic findings when the endometrium is thicker than 5 millimeters after menstruation, or if it's thicker than 15 millimeters at any time of the menstruation cycle. Which can be the causes of thickening of the endometrium? Endometrium hyperplasia, polypi, tumors of the endometrium, especially cancer of the endometrium. The intensity of the echo of the endometrium is reduced in the first half of the menstruation cycle. That means the endometrium is hypoechoic, becomes isoechoic at the mid of the menstruation cycle, and in the second half of the cycle it's hyperechoic. In the ultrasound examination, it is essential to define the contents of the uterus. If there is some liquid in the cavity of the uterus, this may be an indication of pregnancy or bleeding, and the bleeding may also be caused by a tumor. If the mucous membrane of the uterus is thickened, more investigations have to be made. In this case, we detect an enlarged uterus with a lesion over here, a cystic lesion there, which also shows solid parts in this area. So when we take a closer look and zoom to this structure, you can identify a small solid structure in this cystic area, and there is a positive heartbeat. This is a pregnancy of the 7th week.